Can medication improve frontal lobe function in schizophrenia? Have you ever wondered how medication can affect the brain, especially in conditions like schizophrenia? Today, we will look at whether medication can improve frontal lobe function in individuals with schizophrenia. Schizophrenia is often linked to reduced activity and structural changes in the frontal cortex. This condition is sometimes referred to as hypofrontality. It can lead to cognitive challenges such as difficulties with working memory, attention, and executive function. These issues are primarily connected to problems in the dorsolateral prefrontal cortex and other related areas. When it comes to medication, there are two main types of antipsychotics, typical and atypical. Typical antipsychotics mainly block dopamine D2 receptors. However, they may worsen frontal lobe function by decreasing dopamine activity in the frontal cortex. This can lead to an increase in negative and cognitive symptoms. On the other hand, atypical antipsychotics, like risperidone, olanzapine, and clozapine, have a more complex effect on the brain. They can actually enhance dopamine activity in the frontal cortex, which may lead to improvements in frontal lobe function. Research using brain imaging has shown that switching from typical to atypical antipsychotics can increase activation in frontal areas during cognitive tasks, such as working memory exercises. For example, when patients switched to risperidone, researchers observed increased activation in the right prefrontal cortex during verbal working memory tasks. This suggests that atypical antipsychotics can improve how the brain responds in areas affected by schizophrenia. Moreover, studies indicate that atypical antipsychotics can lead to better neurocognitive performance and an improved quality of life compared to typical antipsychotics. Some research even points to early changes in frontal lobe activity after starting atypical antipsychotics as predictors of better treatment outcomes. At the cellular level, these medications can help reverse disruptions in prefrontal cortex activity caused by N-methyldeaspartate receptor dysfunction, which is often seen in schizophrenia. For instance, clozapine has been shown to normalize abnormal firing patterns in prefrontal neurons, which may help restore cognitive functions linked to this brain region. Additionally, resting state brain imaging after short-term treatment with antipsychotics has shown increased neural activity coherence in neocortical areas, including the frontal and parietal lobes. This improvement may relate to enhanced attention and working memory functions. In summary, medication, particularly atypical antipsychotics, can improve frontal lobe function in schizophrenia. These medications enhance dopamine activity, normalize neuronal firing, and increase functional activation during cognitive tasks. While the degree of improvement can vary among individuals, the potential benefits are clear.